Hello, so I'm Dr. Amy and I'm the founder of the Hair Loss GP. This is the first in a series of videos that I'm going to do over the coming weeks about causes of hair loss and just to help you understand a little bit more about the process. So today's video is about why you should see a doctor and what to kind of expect during that consultation. So patients come to me for a variety of different reasons and at sort of different stages in their hair loss journey, but all of them have the same problem in that it's normally having a massive impact on their self-confidence. And they often come to me saying things like they're fed up of seeing kind of the hair on the pillow or in the sink. Often they mention that in sort of family photos or on Zoom calls, when they bend down, you kind of notice the hair loss more in the middle. And actually it's stopping them doing things that they sort of previously enjoyed doing. With hair loss, mainly in men, often it can be the traditional sort of male pattern hair loss, which has a kind of genetic component to it as well as hormonal. However, there are lots of other medical causes. One of the main ones is kind of, especially in women, is hormonal causes. So this condition called polycystic ovaries, which is very common, 1 in 10 women have it, and that can have a big impact on your hair. Also going through the menopause can sort of change lots of things about our hair and our skin, and there's lots that can be done to kind of counteract that. Other causes are vitamin deficiency, so if you've got a low iron or other vitamins and minerals, that can cause problems with hair growth. Also, if you've got an issue with the thyroid, which is a gland in the neck, which is like the boiler of the body and controls your metabolism, that can also cause problems and is very easy to fix with the right medicines. There are also kind of a range of dermatological kind of skin conditions that can cause it, and the scalp is a very delicate kind of balance and environment and a sort of very delicate biome, and actually if that's out of sync, then that can cause problems. There's also autoimmune conditions, which is where the body attacks itself, and things like alopecia areata. So when you come to see either a doctor or a trichologist, some of the things that you should expect is that they should take a really thorough history, asking you kind of about when your hair loss started, how it affects you, what you've tried, what works for you, a little bit about your family history. They should then do a really thorough kind of scalp exam, having a look at what's going on. And then other things that can be useful in some people is doing blood tests, as I said, to look at the vitamins and the hormonal different causes. Other additional checks, which are sometimes needed but not always, is you can do genetic testing to see which medicines might or might not work for you. And there are some other additional scalp assessments if people have got kind of more autoimmune conditions that might need to be done by a dermatologist. Once you've kind of got all those answers and I suppose identified really the root cause of your hair loss, it makes it much easier to move forward with a treatment plan to find out what's going to work best for you and plan your hair restoration journey kind of over the coming days and weeks. So if you've got any questions about any of those things, please let me know, and I'll be doing a deep dive into some of those topics over the coming weeks. Thanks.